Now let's talk about how administrative users can utilize ACE to track physician orders. Physician orders are obtained during both the referral process and subsequently whenever needed. Obviously, physician orders obtained during the referral process was already covered in that part of our training. Right now, we're going to discuss tracking physician orders for the remainder of patients. To begin tracking physician orders, navigate to the Patient section of ACE. Next, we're going to sort our data. We're going to utilize the drop-down arrow in the column for Order Expires Date and select Sort Oldest to Newest. The administrative user will now be responsible for determining which patients need new physician orders requested based upon the date that the current order is expiring. It's a company decision to determine how far in advance to request the physician order, but at least 1 month in advance can be reasonable since it allows time to track down any orders that need corrections or that were not received in a timely manner. To open a patient record that needs a new physician order, double-click on the patient name. Once the patient record is open, navigate to the encounter notes to determine if the patient will require a new physician order. For example, if a patient will soon be discharging and this has been documented, no physician order will need to be requested. If the patient will continue services, a new physician order will need to be requested. Next, the user will navigate to the Physician tab of the patient record, and they'll click the Add New Physician Order button. The action of clicking the Add New Physician Order button will move all data from the New Physician Order section to the Old Physician Order section of the form. The treating physician information remains on the top portion of the form. The user should now enter the new order requested date and the new order effective date. The expires date will automatically populate to 6 months following the effective date. Next, click the Physician Order for Reauthorization button. At this point, the user may send the physician order for reauthorization, send the order to an alternate fax number, such as perhaps the head nurse, or print preview the document. If the user chooses the Send Order to Alternate, this screen will appear. This allows the user to send the order to a different fax number, or if you need to send it perhaps to someone's attention, such as the RN or the office manager that's helping you obtain the order. You can enter his or her name on the To line. You can enter the physician or the practice from the drop-down menu, and the fax number will populate. You can change this fax number as needed. When the user sends a physician order, a pop-up message will appear to let the user know that the fax was successfully sent. The user may click OK, and the process may be repeated for all necessary patients. Physician orders that have been requested but have not been received need to be tracked routinely to avoid a lapse in services. This type of tracking is done by means of a report. Begin by navigating to the Patient section of ACE and clicking on the Patient Reports button. Next, locate the report named Active Physician Order Not Received and click Run Report. The user may then utilize the report to follow up on any missing physician orders appropriately. Additionally, the user may choose to utilize this same report and export it to Excel. Exporting the report to Excel is great when the user needs to sort the information, delete sections, or even add any comments. This concludes the instructions related to tracking physician orders in the administrative portal of ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written Administrative ACE manual for detailed instructions and screenshots related to specific features and tasks.